Dr. Sanjeev Bagai, to you first. How serious of an impact would we now see by US quitting the World Health Organization as far as, funding for disease research, the medicine and equipment delivery to different countries is concerned, especially, the developing nations, which really benefited from the kind of medicines and equipment that the World Health Organization provides to them?
Good evening. I think this was very much expected, but actually I am not disappointed, and let me explain why. WHO was formed almost 76 years back in 1948. We have a present person who's heading it by the name of Mr. Tedros, who's been here for about 8 years of his failed tenure. Its funding is about $7 billion US dollars, in which US is a very large contributor. And it has 7,000 employees, 6 different regional offices, 194 member states. But it was made after the devastating 2 world wars. Over a period of last 7 decades or so, it has not evolved to meet the needs of the member states. We are looking at it only from one point of view as to what will happen to certain countries which were depending on it. So let me explain why WHO has failed. And then we will understand why the present president, Mr. Donald Trump, has withdrawn from it. If he says he's withdrawn from it, he has not said what he may do in the future. So maybe there is a parallel organization which is better and better administered. Maybe there is a restructuring of the WHO in times to come, which is much needed. Its main objective, WHO's main objective, was to improve public health care globally. It was to alert and message for and preventing control of global epidemics and pandemic. It sadly failed. Now, if we just look at COVID in the recent history, 10 or 12 major reasons why all the medical fraternity is so disappointed with WHO. It failed to alert, prevent, control, and even identify the origin. There is no independent inquiry even after 6 years of this pandemic starting to the global public. 6 to 8 weeks prior to them actually announcing it is airborne, 76 global scientists had to tell WHO that it is airborne. We missed precious time in which the disease spread. No adequate vaccines were provided to the most vulnerable population of Africa. Less than 4% of the African population was, in fact, vaccinated during the first and the second wave. There was zero preparedness as far as the world is concerned. That was its job. It failed to do its job. The pandemic actually started in December 19.
Okay.
It was declared as a global health emergency only on 30th of January 2020. We missed 2 months. And then a pandemic on 11th of March 2020. We missed 4 months of alert. By then, the infection had spread worldwide. On top of all this, Mr. Tedros praises China for its effort. Terrible communications globally during those 3 years of the pandemic. Yes, WHO has done some work in smallpox eradication and polio and TB control, but it has failed to control Ebola, influenza epidemics, the public health of most countries. Look at South Pacific Islands. They are languishing. And the reason why I'm saying this is, in real first-hand information, I have traveled to these countries. You have to look at the public health infrastructure which exists and the disease spectrum of most countries in Central Africa, including places like Congo, Ivory Coast, Tanzania, Kenya.
Okay.
Look at countries like Fiji, Togo, Vanuatu, or even Papua New Guinea. They are way behind. They're at least 40 years behind global standards. What has WHO done? So I'm not surprised, neither I'm disappointed, but I would like the president of USA to take a central role to restructure global health. USA's presence is mandatory. US presence is extremely important, but we have to have a more equitable distribution. You can't have a country like China, which has 1.4 or 1.5 billion people contributing just 1/8 of its share, whereas US, which has 1/5 of the population, contributing 8 times more. So there's a disproportionate funding, and I think all these things need to be corrected.
This is what Donald Trump has reasoned as well, Dr. Bagai. And you know, this, what you're saying, it has been said a couple of times, and it has been reiterated time and again in the past as well, that global agencies like the WHO and United Nations have become redundant at this point because they're not really fulfilling the goals they were set up for. But